Now, when I was at EASD 18, I talked to our next guest, Martin Haluzik. He was a wonderful speaker, so I've got him back again. First, because I know that he's chairing a session today, and I want him to tell us about that. But I also know that he's on the scientific board for next year's Congress, so perhaps we can get some tips out of him as to what we might see there. So, Martin, first of all, tell me a bit about your session.
Okay, so my session that is going to start in 25 minutes is focused on the neurodegenerative diseases in patients with diabetes. And I think it's a very interesting and a very relevant topic because our population of patients with diabetes is getting older. Therefore, there is increased risk of neurodegeneration, and there is a clear link between insulin resistance or decreased insulin sensitivity in the brain and the risk of Alzheimer's disease, Alzheimer's dementia. So I think it's very relevant to explore this.
And it's roughly double the risk, isn't it?
Yes, that's right.
So is it a question, we saw from somebody yesterday that the incidence of diabetes may be plateauing, and we've also seen in other works that the incidence of Alzheimer's may be plateauing. Are those two things connected?
They certainly are connected, and it appears that in both cases, decreased sensitivity to insulin or insulin resistance play an important role. So in case of Alzheimer's, it's decreased insulin action in the brain. And the interesting thing is that it appears that some of the glucose-lowering agents, in fact, can also improve neurodegeneration or prevent neurodegeneration.
So in fact, this is a very important public health message that we need to get to governments and health authorities, that actually they really need to be treating diabetes if they want to prevent more cases of Alzheimer's, which is a major public burden. I mean, diabetes is a public burden, but Alzheimer's is an even greater burden.
Absolutely. I think it's very important, and it's also very important to diagnose diabetes early, because this is still a big problem we have, that we just type 2 diabetes doesn't have specific symptoms in some patients at the very beginning. So it may happen that we don't diagnose type 2 diabetes for a couple of years. And in the meanwhile, the patients may have complications. Therefore, I think we should get better also in early diagnosis of diabetes.
What about the other speakers in your session? What are they bringing to the picture?
So this is a session of the oral presentations. So it's a very nice mix of some experimental studies, because there are some experimental models on the mice and rats that then we can explore new anti-diabetic medications. And there are a couple of human trials looking into the effects of, for example, GLP-1 receptor agonists, which is one of the most promising class as far as treating both diabetes and possibly also neurodegeneration.
And turning it slightly on its head, should the diabetologist be on the lookout for signs of Alzheimer's?
Oh yeah, I think that's an excellent question, because it's not only important in a way that we can prevent it to a certain degree, but it's also important when we consider medication, because patients who have sign or like early dementia, we have to be very careful about side effects of the medication, such as hypoglycemia with insulin or sulfonylurea, for example. So that's very important.
Now, give us a sneak peek. What are you going to be looking for as when you're on the scientific board for next year?
Well, I think there is many things going on. We still will hear more about new medicaments like oral semaglutide. So we have some peptides that can be given orally, which I think is still one of the most interesting things. Then there will be data from some cardiovascular outcome trials with SGLT2 inhibitors, again looking on the influence of these drugs on the risk of cardiovascular complications. There is a lot of good science. There is, for example, a focus on the fatty liver disease that is, again, one of other burdens that we need to treat. A lot of interesting sessions looking into perspectives of treatment of dyslipidemia, some new anti-diabetic agents as well. Really a lot of things going on.
And anything coming up on the horizon that's new? I mean, we're seeing, for instance, microbiome increasingly being implicated in diabetes. There are a lot of other interesting areas like that.
Well, I think we may hear some interesting new information about neurodegeneration and some anti-diabetic medication, because I believe that there are some ongoing trials in humans that should be finished and hopefully presented on the next EASD. So that would be one of the very interesting areas to look at.
He's teasing us with all this excitement. So I'm very grateful to you for taking the time, because I know you're busy with sessions today. But yes, book your tickets for EASD 20. Thank you so much.
Thank you very much.